Hello, Michael.
Hey Wesley, how you doing?
Good. How about you?
Pretty good.
Good to see you. How's your morning been and your day been thus far?
It's been a while. When I was trying to I'm visiting my parents, so I was trying to connect to their Wi-Fi and everything and get everything set up. I actually just got here about 30 or 40 minutes ago.
Okay. All right. I'm glad you made it. How are they doing, by the way?
Pretty good. Pretty good.
Are they pretty close to you, or are they kind of a drive?
No, I had to fly. They live in Tulsa, Oklahoma.
Oh, wow. That's
Yeah.
incredible. How is the situation for Tulsa in general right now?
Nothing is compared to us.
Okay.
Yeah.
Is there still stay-at-home orders in place and some
I don't
social?
even I don't even I don't even think so. I haven't had a chance to look and see, but I just noticed that I know my Lyft driver told me that a lot of places are opening back up.
Wow. Okay.
Yeah.
All right. Well, stay healthy and keep them safe while you're there. How long are you going to be spending with them?
I think 2 weeks
Okay.
because first of June I'll be moving, so trying to get everything situated.
Yeah, we're gonna miss you over here in Chicago. But
Yeah, I hope I'll be able to really get involved there in North Carolina.
yeah, I mean, one of those things. I wonder, have you reached out to anybody here to determine if we have any connections? Because I'm not as familiar with
Well, I
that.
asked Monica, she referred me to Andrew. And Andrew sent copied me on an email, and I also sent the email to the guy that's over the North Carolina, and he's located in Charlotte, but I haven't heard back from him.
Okay. All right. Well, I hope for the best. Like I said, Southern hospitality goes a long way. So a lot of people who live or have been down in the South say like people are always so amazingly nice down there. So you've at least got that to look forward to.
Yeah, I grew up in Chicago, and I also grew up in Louisiana, so
Okay.
best of both worlds.
All right. Very nice. All right. Well, we're just going to give Christine and then Dr. Samra a couple more minutes here, and then
Okay,
we'll
how's
be.
your time? How long you been in Chicago?
I've been here most of my life. So I've lived in Rochester, New York for a few years, so Western New York.
Oh, that's
And
the true winter place.
it's pretty similar to Chicago actually. So a lot of the cold fronts that get to Chicago get to Rochester about 1 or 2 days later. So you can get a good prediction of what's happening there by looking here 1 or 2 days earlier. And then I lived in South Korea for a year. I was actually a teacher in South Korea.
Oh wow.
Right. So hopefully Christine and Dr. Sommer will get on.
Oh man.
Hello, Dr. Sommer. How are you?
Hi everyone. How are you?
Hey,
Well,
doctor.
Hi, Michael. How are you?
I'm doing good, and yourself?
Good, good.
how's your day been so far?
So I've been doing a lot of televisits from home. It's been going well. It's been going well. How about you guys?
So far, so good.
Good,
So far, pretty good.
good,
And
good,
then we've got
good.
our
And so,
first.
Michael, how are you doing? Are you doing televisits then right now for your follow-up?
Well, I made my year, so I don't go back to the transplant
Congratulations.
for a year.
All right.
So I just have to make the decision if I want to have it moved to North Carolina or come back to Chicago to do it
Oh,
for next year. But they said they can move because I'm a January, so they said they could move it to July instead of coming January.
okay.
So I
Got
think
it.
for right now, I think I'm gonna wait to come back and do it there. since I'm familiar with all the people, because I've heard, I've heard, well, a lot of other hospitals don't like dealing with other transplants if it wasn't done
Yeah.
there.
Yeah. This is
Hello,
true.
Christine. How are you?
Hi,
Hi, how are
Christina.
you?
Good, good. Looks like your audio's rocking and rolling. You're ready to go.
Yes,
All
I'm
right,
ready.
great. How's your day been going thus far? Well,
So far so good. I had dialysis this morning, and then it was a good dialysis session, so I'm feeling good. Thank you.
Good.
great. All right, well, we're just about 2 o'clock, so I'm going to go ahead and post this live, and then we'll get started. But everybody looks great. I'm excited to do this, and I hope you are all very excited as well. But thank you again, and let me get us, bear with me. All right. So I'll just pause briefly and just make sure everybody's available here. Okay, well, thank you everyone for being here today. Welcome. Good afternoon, and we're really happy to have you all here today. Y si habla español, buenas tardes, bienvenidos y muchas gracias. My name is Wesley Bauer, and I am the Development Associate with the National Kidney Foundation of Illinois. And in addition to that, I will be your moderator today for NKFI's virtual panel, Coping and Hoping During Uncertain Times. Thank you all for finding us today, whether you're a kidney patient, a caregiver, a healthcare professional, or just a good neighbor in your community, and you're interested in learning more about kidney disease and people navigating the health crisis. We're really happy to have you here today, and excited to join us here. I'm gonna take a moment here just to kind of put us on Facebook and make sure that we're all good to go. Looks like some of us are not quite seeing us here on Facebook quite yet. But while I do that, I just want to tell you all a little bit about our event today. And our event today was kind of prompted by this larger global movement known as Giving Tuesday Now. And so some of you may be familiar with Giving Tuesday Now, but for you that are not familiar with Giving Tuesday Now, Giving Tuesday is kind of this national movement that comes about every year right after Thanksgiving. It's usually the first Tuesday after Thanksgiving. And it's a movement to kind of support philanthropic organizations, charitable organizations, and then service organizations like NKFI to help them serve their communities and support their missions. And Giving Tuesday Now, which is today, the 5th, came about because ultimately there was a unprecedented need in regards to the spread of COVID-19 and the pandemic. And so as a result of that, a lot of these communities came together globally on a really wide scale and said, let's have a Giving Tuesday now to support this need and to kind of make sure that things are available for people, that opportunities are available for people to support these communities in meaningful ways right now. And so NKFI said, well, what can we do as a part of this movement, and how can we support that? And I think one of the biggest ways that we felt we could participate in this and be a part of it was highlighting the stories and the experiences of the communities we serve in our kidney communities. So whether it's healthcare professionals, kidney patients, caregivers, just people in the community that are trying to support our communities that way. We felt like this was a great way for people to learn a little bit more about what it is that we do and what it is that you all are doing right now, and your strength, your coping, and also your inspiration during this really difficult but also, really important time. And so without further delay, I want to give you all a chance to just briefly introduce yourselves, give us an opportunity to learn your relationship to the NKFI kidney community. And then from there, we'll just ask some questions, learn a little bit more about your journey, and also some sources of hope and some ways that you're finding positivity at this time. That's kind of why we call this coping and hoping during uncertain times. So with that in mind, Michael, let's go ahead and start with you. Could you introduce yourself and your relationship to the kidney community?
Hello, everybody. My name is Michael Phillips. I live in the Chicago area. I was diagnosed back in 2012 in Dallas of the kidney disease FSGS. 2016, I started dialysis, and last year, on January the 6th, I received a kidney. So it's been a blessing. So I've been involved with the Kidney Foundation as an advocate for about 3.5 years. Been on dialysis and learning more and more about different diseases and different communities of how kidney disease affect. I just want to be able to try to inspire people and try to be a kind of a motivator of how to navigate through it from my experience, because I know everybody's experience is going to be totally different. I started a blog when I was on dialysis, and that was kind of interesting because I'm a very private person, but I went from day one to probably right after I got my transplant. So I haven't said anything, done anything about with my transplant, but and that information can be provided too. But yeah, so I'm a happy camper. I got my transplant and I feel wonderful. I got all clear my first year, so I don't see them for another year. So kind of good not seeing a bunch of doctors anymore.
Well, thank you, Michael, for that, and I'm glad to hear that you're feeling good and feeling happy, and congratulations on the good success thus far. We're really happy to hear it. Christine, how about you?
Hi, my name is Cristina Hernandez, and I'm a dialysis patient, and I also live in the Chicagoland area. And I got involved with the National Kidney Foundation because I just felt like I wanted to help, if not support people, help them navigate with their disease if they feel they need education or any kind of support, be that person a supportive person to people that might need support, and also to let them know that it's going to be okay and that better days come. We have bad days, we have good days, but more good days than bad days, and just any questions they might have, I'll be glad to answer them. I got diagnosed in 2015, and I have genetic kidney disease. It was diagnosed through a biopsy. That's when I found out. We usually find out later in our disease process. So I was stage 3 when I found out that I had kidney disease.
And then how are you doing right now, just in general? How are things going today and more recently?
Everything's okay. You know, I take it one day at a time. I actually appreciate the fact that, you know, I'm so sorry. I'm tongue tied. So I'm registered at Northwestern for a kidney transplant. I did that process, and I appreciate the fact that the doctors in the transplant centers are being so careful with, you know, with this new disease, the COVID, and not taking any chances to get, you know, anyone sick, or um, there's so many resources for us out there, and just being extra safe. It makes me feel safe that, you know, knowing that people, doctors, medical professionals, they don't want to take chances with our health and rush something that could be done a little later, because with dialysis we could be just fine.
That's great. And again, thank you for being here. You know, it's good to hear about your journey, and we're going to learn a little bit more about it today as well. So thank you for sharing as well. And then Dr. Samra, can you tell us a little bit?
So my name is Manpreet Samra. I'm a transplant nephrologist at the University of Illinois in Chicago. I live in Chicago, and as far as the NKFI, I have been on the professional advisory board and have been fortunate enough to volunteer in the NKF mobile days as well. I think, I mean, the nephrology, you know, starting from chronic kidney disease to our dialysis patients to the transplant side, I mean, everyone has been affected so uniquely right now. And it's been quite amazing to see the collaboration and the real feel of community.
Fantastic. Thank you for being here as well. And thank you for just being a part of the greater community as well as a frontline worker. That's amazing. Um, so I wanted to start today by trying to give everyone who's viewing this an opportunity to better understand perhaps some of the more unique challenges that all of you face in your unique roles and unique identities as part of this community. So Michael, we'll start back with you again. What have you been navigating as this health crisis has been evolving, and how have you been coping with that? Can you give us a little bit of a better understanding of your experience?
Uh, Basically, because I had my transplant last year, so was recovering from that. And then for, I guess, a couple of months, you know, I felt free, and then COVID hit. So I feel like I'm locked back into the house again. But I've been reading, you know, talking to friends as I was doing when I was locked in the house, recovering and stuff. So it kind of like just blended right on in. Um, I've been doing a lot of research about it, trying to understand it and see how it affect me being a transplant person. Because early on, I believe in March, I wanted to travel to see my mother, and I couldn't at the time. And so that was kind of like a little frustrating, you know, because I guess, you know, making sure. And at the time, I really didn't even think about, I didn't have any symptoms at that time, but I didn't even think about, you know, how it could affect me. You know, I did have COVID. I had it. It snuck up on the third week. Everybody in my household did. It snuck up on us on the third week of March. I had a mild case. My spouse had a really bad case, had to go in the hospital and everything. So, you know, just dealing with it. I've known 3 people that didn't make it because of COVID. So, you know, still coping with it, trying to understand that, you know, it's going to be a new normal. You know, things are going to change or has changed.
Thank you for sharing that. I'm happy to hear that all of you are doing better. It sounds like all of you are doing better, Michael. Is that the case? Is everyone healthy
Yes,
and on the up and up?
yes. Once we broke that fever, everything started getting back to normal.
Okay. Well, give your best to your family members as well. And I'm sorry to hear about the loss that you've, you know, experienced in your community. And hopefully that's a good lesson for everybody that's listening or watching, just to continue to abide by the health recommendations and the guidelines, because we're very much all in this together. And, you know, we're
Yep.
protecting yourselves, but we're protecting our communities as well and the people we know.
Yes.
Christine, how about you? Can you tell us a little bit more about your experience, how you've been coping, and what it's been like for you?
Um, it Initially I was very nervous and scared, but I learned that with precautions and not taking chances, uh, uh, listening to what they say, not to be out in crowds, um, wearing protection to protect others from my cough, because that's what the masks do. But they're comforting also, just to know that you have them on you. I just go to dialysis. I come back home. I'm learning how to bake. I'm trying to uh, do that right now, and um, we keep busy here. So I have a really big family. We like to swim, so we do that kind of stuff here in my house. So we don't have to leave. On my dialysis days, I rest, and then when I feel better, I could go to my backyard, or I'll walk around the block by myself and take a little walk just for some exercise. Of course, with my mask on. Um, but I it's been okay. I mean, I think it's gonna be like a new normal, like Michael said. There's just gonna be new habits we're all gonna be getting. Not only us in the kidney world, but everyone in the population. I think everything's just gonna be new and different, new habits.
I mean, it's good. It seems like you have the right perspective on the experience too, of just knowing that things are changing, we're all adapting. So, moving forward, we can slowly adjust if we do things right and, follow all the guidelines and what we need to do moving forward. Dr. Samra, how about you? What has been, from your perspective, what has been something that's been kind of difficult and a challenge in your field and your experience, and also how are you coping with that and navigating that?
So professionally, it's been difficult kind of navigating new telehealth platforms so that we can make sure that we communicate with patients and are taking care of patients, even though our clinic physical capacities have been cut down by upwards of 50 to 70%. We've stopped all living kidney transplants, and just making sure that the patients are keeping safe even when they're getting their labs drawn. I mean, we're trying to make sure that there's just no unnecessary exposure, especially for the transplant patients who we know are immunosuppressed. And so we're thankful that, the community has actually put together mobile phlebotomists so that patients don't have to come out and be exposed to large labs. So that's been one of many on a professional front. Personally, in the beginning of this, I have a 3-year-old son, and my husband, we were all at home. And so you can imagine trying to work from home, take care of your 3-year-old son, and kind of go day to day. I mean, now that we're 6-7 weeks post that initial shutdown, I think we are beginning to adapt. And just like Christine was saying, it's a new normal. And I found that a few weeks ago, I personally was resisting the new normal. And it's important to kind of embrace it. And just like what Christine and Michael said, to get used to the fact that this will be our new normal going forward.
Yeah, and I think that's a phrase that we hear a lot now, is the new normal. And I think some people were kind of resistant to the idea, but I think now a lot of people are coming around and are adjusting to it, which is great. Even actually at the national level, the National Kidney Foundation, which is based out of New York, whom we're affiliated with at the National Kidney Foundation of Illinois, they're doing a webinar on Thursday called COVID-19 and the New Normal. So, if people are interested in learning a little bit more about what kidney patients will need to do to adjust to that and protect themselves, they can also seek that out too, kind of to your point, Doctor. So, I want to kind of balance things out. So maybe ask one more question about the more serious or the more worrisome adjustments, and then talk a little bit about the hopeful side of things, because I think that's important to have. But I wonder, what's been one of the single most maybe worrisome or concerning parts of this experience as you've been navigating this, and and how did you overcome that, or how are you overcoming that with your different identities as kidney patients, as service workers, as healthcare professionals? What have you done to try to adapt to that particular worry or concern? And Dr. Samra, we'll start with you.
So, one of the largest concerns that we've all had, I mean, especially in the healthcare worker, kind of the professional side, is how do we mitigate the risk for our patients? And how do we make sure that we catch this early? And that has been, I mean, in the very beginning, there was just so much concern, so much anxiety, and so much fear around everything. And I think the number one reason for it is the unknown surrounding it. We know what a pandemic is, and we're familiar with what coronavirus is, but we're not familiar with this virus. We're not familiar with this transmissibility. We're not familiar with, if our patients get COVID-19, what do we do with their immunosuppression? There were no guidelines, we didn't really know what to do. And so that in the beginning was extremely, extremely difficult. Now, I mean, with the collaboration of the medical community, we have multiple forums where we're sharing what we're seeing with our patients. We are sharing good practices. There are guidelines from the professional associations, and these have helped tremendously to overcome these initial fears and anxieties.
And it's good that the medical community seems to have really just gathered together and just worked really hard, and to their credit, everybody involved is really working night and day, 24/7 to try to figure out, how this virus afflicts people, how people can navigate this in a healthy and kind of very, very health conscious way, which is great.
Right.
Christine, how about you? Is there one particularly concerning thing or worrisome aspect of this experience that you've been trying to navigate, and how have you found ways to navigate that and overcome that?
Well, with me, my number one fear, of course, is contracting the COVID, right? But my husband, he works in the hospitals, and he also works at doctor's offices, so he has to be out there and people for COVID, having COVID patients. So it's like a little scary knowing that he has the patients, and then he has to, it's like a whole routine he has to change before he doesn't, like we had to have something like concrete, like a plan of action to try to minimize anyone here getting exposed to COVID. So we've been doing pretty good, I think, so far, because we've all been safe, and just having a routine, and just following like guidelines, wash your hand, be very careful if you change your clothes, take a shower, like that kind of stuff, where not taking chances, even like after dialysis, because I don't know, I know what I have, but I don't know what the other patients have. So knowing that I'm being careful, then I'm responsible for myself.
Yeah, I think that's inspiring too, is that you find comfort, but also you find just logic in following these guidelines, and you know that they're going to protect you and everybody around you, and that there's a lesson there, not just for those people in your immediate vicinity, but also for other members of the community, to say like, okay, you know what, I see that people like Christine, people like Michael, are going to be better off. It's not just about me; it's about the people around me too that I really care about, which is really important. And then Michael, how about you? What has been something of particular concern or worry for you, and how have you been overcoming that?
I think my biggest fear is with my parents, because I live so far away from them, and they are of an older generation. And I have just in Chicago alone, I have a great aunt that's 95, and worry about her as well, because I guess it's so much unknown. And so I try to do yoga, meditate to keep my sanity. I think I have anxiety now. When I do go to the grocery store, I look around like, I don't even say 6 feet. I say 10 feet away from me. Because I think a lot of people, unfortunately, I hate to say this, but it's like some people don't learn unless they in that moment and it happens to them. Because, I look around the city, I see so many people just like no care in the world, no mask, no nothing. And it's kind of frustrating. But what I've learned with this is that I am responsible for me. Can't worry about nobody else. I worry about my family that, that's in my house and stuff. And we've always taken precautionary period, but this is took it to a whole nother level.
Well, I'm glad you're taking extra precaution. Better safe than sorry, right? I mean, if you have to
Yes.
put a few extra feet in between you and the person next to you, I think, it can only help. And frankly, that's a good lesson. I'm glad you spoke about that for everybody listening who may not take it as seriously. I've met people who kind of bristle at the fact that they need to walk into a place and maybe put on a mask or do that kind of thing. Some of my own family members, I won't say whom on this, but it's an important lesson, I think, to remind them that, what, if at the very least it makes people feel better, why not? Why not follow through on that and do that? And I have to brag about all three of you, because all of you have, multiple identities that put you in many different positions. And I want to just recognize that. So Michael, in addition to your identity as a transplant patient, you're also somebody who's worked, in the service field as a CTA conductor. Christine has worked as a registered nurse for over 10 years.
Oh, amazing.
So in addition to your identities as part of the community, you're also on the front lines along with Dr. Samra. So thank you many times over for what you do, not only for yourselves, but for others. This is quite an amazing group. I'm in very, very esteemed company right now. So I'm just honored to be here with all of you. All right, so I'd like to take an opportunity to transition into some more hopeful and some more forward-thinking questions at this time. So as some of you have already mentioned, this has really created an opportunity for adaptation, a new normal.
Mm-hmm.
And I think part of that requires all of us, both individually with our families and then in our communities, to find opportunities for inspiration and to stay positive. So what are some ways that all of you are staying positive and staying motivated? Because I think everybody needs to hear this, and I think everybody watching this will get some great ideas and great inspiration from all of you. So Dr. Sharma, how about you? What are some ways you're staying inspired and motivated?
So comedy, I'm using comedy quite a bit. SNL has put on virtual shows. John Krasinski has been doing Some Good News, which has been really positive and inspiring. And then just looking around, I mean, sometimes just seeing a positive message written in chalk on the sidewalk is inspiring, thank you for what you're doing, keep at it, or, signs at Navy Pier. It's really just looking around and knowing that, we are going to come to the other side of this, and that's been extremely helpful. And like Michael said, connecting with family and talking with friends, using the virtual platforms and the technology that is available to us at our fingertips.
That's great, and I'm glad you mentioned the inspirational messages. Something just popped up on my street over the last couple of days. I went out to the grocery store, I had my mask on and I was ready, and someone has posted signs on successive buildings on my block, and they're high up. They're like 30 feet off the street, and they say in cursive, "We're all in this together."
Oh, wow.
So I don't know if that was a local artist or if it's just somebody in my neighborhood who did it, but whoever did that, if you're watching or if you see this, I love it. Keep it up, because that's the kind of thing that makes me happy to see in the neighborhood. Michael, how about you? What's keeping you positive and motivated during this time?
I guess for me, it's like realizing that life is so short. I think it's just like a reiteration for me. enjoy every minute that you can, because there's no guarantees, you know, because things can change just instantly. And to see that happen, it's kind of like, wow, you know, you see the news, you see all the things that's happening, and you're going like, wow, you know, and I'm like, it could have been me, you know. I see the food lines and stuff, and I see, you know, they're showing the kids and stuff. And I'm like, no kid in this country should be going hungry, you know? And so I look at all the causes that I'm trying to get myself involved into, and also trying to get myself back into the workforce, you know, full time and stuff. So, you know, try to stay self-motivated. I read a scripture every day. And I have good people. I have good people in my circle that we always checking on each other, making sure, you know, how's your day going? Because I know I have a lot of friends that still have small kids, and trying to, you know, I see now, my brother is a teacher. I notice a lot of people are putting out on social media how much they appreciate teachers now, you know. But no, you know, I'm a self-motivator, and I'm constantly reading. When I see, you know, I just pray that everybody stays safe.
And I think between a lot of what you're doing now, and you mentioned that you're involved in a lot of causes and a lot of, you know, advocacy, something you mentioned at the beginning too. I think that is something unique to a lot of the people in our community too, is that a lot of them are inspired by their experience, but then educate themselves and want to give back, which, you know, that's not to say that everybody has to, but a lot of people I think are moved to do it. So I think for that reason, you're a great advocate for that and a great voice for that. So we're lucky to have you in our community as well. How is your, now I want to follow up and ask, how is your meditation and your yoga going? Are you finding some peace in that and some joy in that?
With the meditation, but with the yoga, I'm finding how out of shape I am. And I'm not 21 no more.
Just give yourself enough recovery time between days. That's important, I think, always. So one of our staff, Monica Fox, our director of advocacy and outreach, I'm going to brag on her a little bit. She also is keeping herself healthy at home, and she gives herself enough time for rest in between days. And it's something that I think she's also finding comfort with too. So happy to hear that everybody's pursuing it in different ways, their physical and mental health. Christine, how about you? What are some ways you're staying positive and staying motivated?
I think just seeing, it's so sad to say, but this tragedy of COVID has brought like the best out of people. Appreciation for things that we didn't think about before, the truck drivers that bring the food to the supermarkets, the people at the supermarket stocking them for us. Everyone that's working, like everyone has a purpose, and people noticing that is just so amazing, and appreciation for one another. I just feel like it's brought like a togetherness that we didn't have before. It was like everybody was so busy. It was like all of a sudden we would just had to stay still for a second, and when we realized everything around us, like it's like a new appreciation for life.
Yeah, I think that's fair to say, though. I think in these challenging times, and at any time that's particularly challenging, you hopefully stop to appreciate the things around you, whether it's people, you know, the resources you have, you know, the love that you feel in your community or your family. I think all of it's worth stopping and saying, wow, it's great to have these things in my life. And that's lovely. All right, and then something else I was hoping that all of you might take some time to reflect on today as well is this is very much in line with Christine. Your last thoughts here is taking the good from this experience and appreciating some of the positive that has come from it. I wondered if all of you had some things that you've noticed that have changed in a good way right now that you hope will continue beyond this in the future. You know, when we return to a new normal, when we're able to get back to life as we knew it before, what are some things that you hope will continue that we're like, wow, you know what, this was a good change. I hope people recognize this and carry this forward. Let's start with Dr. Samra. Go right ahead.
Sure. So I think You know, right, Christine, right, based off what you said, I think that practice of gratitude, I know that's become a very big focus for us in the family, for us in our community and in our friends, and I really hope that sense of gratitude continues. There's been an embrace also to the slowness to life that this has brought and to the removal of that badge of busyness, if you will. So, I mean, for that to continue, I think would be wonderful. It helps that there's light traffic driving into work, and the pollution levels have been, very low.
Yeah, I mean, agreed. I think there's been some amazing news coverage of that too. Just I think some of the flamingos that have gathered in India. Usually, there's a smaller population that comes there every year, but now I think there's been an increase of 25%.
Oh, wow.
Just as an example, and I saw that, and the pictures are amazing, and just seeing how some of the animals are coming out, and people are stopping to appreciate other living things around them. It's pretty incredible. So yeah, it's nice to appreciate the planet that we all live off of
Yes.
a little bit more, which is really important. Michael, how about you? What's something positive that you hope is going to continue beyond this?
I hope that people still stay self-aware. I hope people still go back to caring about other people. And, I think we're in a world of selfishness, but I hope that this has changed. I believe that for me, I believe it was just a wake-up call to slow down, enjoy life. We all so busy. And when we sit back now, we think about what were we busy doing?
Yeah.
I think sometimes we're busy just for to be busy. And I think sometimes you just have to smell the roses and just relax, take care of self, not forget about the people that has helped you along whatever journey you've been through. And I'm one of these people that when somebody comes to my mind, I have to text them or call them or email them right then and there to see if everything is okay. That's just always been in my nature. So I just think, I think hopefully this is making the world a kind of place.
I think you're a big agent of that. I mean, I'm a big advocate for picking up the phone and calling people and hearing their voice live and in person too. So you're my type of person when it comes to checking in on people. I resisted making the transition to a smartphone until very recently because I always wanted to pick up the phone and hear somebody's voice. So I'm in the same camp as you when it comes to that, just connecting with people. Christine, how about you? What's one other positive or happy thing that you feel like has come out of this that you hope will continue?
I just hope that we could all just have one appreciation we could hold on to. Me, believe it or not, it's just life is so busy sometimes you don't even you think you know your kids and you don't know them. So just getting to know them, taking time out for them, individual time, letting them express themselves and just not hearing but listening. So taking time out to listen and be that ear that someone might need. Maybe not my kids, maybe someone else might need listening, or a friend. And so just being that person that people could count on.
Now, may I ask, Christine, how old are your kids and how are they doing at this time as well?
I have a 14-year-old. She's going to be 15, and she's doing really well. She's got straight A's in school right now, and she's coping really, really, really well. And then I have my 12-year-old boy. He has autism, and he's doing really well too. I got his report card yesterday from the school, and he has straight A's also. I'm like, wow, you guys are really doing well, and the teachers telling me that they're doing all their work, submitting it on time. They're never late. And so knowing that they're doing the right thing makes me so happy.
I think they've probably they've had you as an example. They've got a warrior as a mom, so you know they've got to live up to that expectation. You know.
Thank you.
So all of you are pulling at least triple duty then. So you know, part of the kidney community, frontline service workers, parents who are just rolling with the punches and rocking and rolling. Hopefully, all your kids and families are doing well. Michael, I know you have a 17-year-old. How's he doing?
He's doing good. I actually have two older sons, 130 and 126. And the 17-year-old is a different generation. We had a conversation the other day, was like, if it was back when I was 17, we would have lost our mind, because we were used to going outside, going over each other's houses and hanging out at the mall or going to the park and all of that. This generation, their head is down all the time, and they just chat with each other online. You know, they wait until they get home from school and play the game, and then talk to each other. Don't talk at school. It's kind of weird, but yeah, it's interesting.
Yeah.
It sounds like
my daughter has virtual sleepovers.
Wow.
So are they staying up and chatting online throughout the entire evening? How is that working?
Yeah. And then they'll all like be asleep and fall asleep, but with, you know, online, and then they'll wake up. Hey, you fell asleep first. No, you fell asleep first.
I feel like that's one thing we can all learn from in this situation, is how to adapt through use of technology in really creative ways as well. So we can take some of those lessons. Dr. Samra, how about you? You mentioned you have a 3-year-old at home. How are things going with family?
So he's doing fine. It was, difficult to explain to him why everything is closed, and, why we can't go outside and play anymore, and why we can't go to the museum. And he gets that coronavirus is currently a thing, and that it has caused everything to stop, and it's the reason why he can't visit his grandparents anymore. But I mean, overall, I think he's doing fine. He's safe, and he's adapting.
All right, fantastic.
Yeah, I love this idea of virtual sleepovers, though, Christine.
Yeah.
I think a lot of us who are older would probably fall asleep by about 8:30, 9 o'clock, though, and would never make it. So we'll have to adapt that. Maybe a virtual, after dinner chat or something. At most. All right. Well, I'd like for all of you to hang on, because I'm gonna ask you maybe one just final thought to wrap up in a moment. I want to also take a look at the chat here and maybe invite some of our attendees to make any comments or ask any questions, since we've got a little bit of extra time. So one note here from one of our Zoom attendees says, Rhonda, I am a week kidney transplant out, and thank goodness for technology to help stay connected, which Michael, you said congratulations. I'll second that. Congratulations to Rhonda.
Congratulations, Rhonda.
Congratulations.
That's great to hear, and I'm glad you could make it today, Rhonda, and hopefully you're finding some inspiration, and stay connected to everybody here if you can as well. It looks like I'm going to give Monica Fox, the Director of Advocacy and Outreach from NKFI, she's with us here by phone, so I might invite her to maybe just say a few words if she's ready, if she's willing. We'll see if she's able to get on here. Monica, are you there?
I am here.
How are you, Monica?
I'm great. Hi, everybody.
Hi, Monica.
Hi, Monica.
I have to say, this is such a feel-good panel. I was just sitting here thinking, oh my God, I feel so good listening to this. You guys have such amazing ideas about how to cope with COVID-19. And I was thinking to myself, wow, I want to be friends with all of them. And then I thought, oh wow, I am friends with all of them. How cool is that? Lucky me. But I really want to thank you guys. This has been totally amazing. And I truly hope that those who are watching will share the importance of NKFI with their friends and with their loved ones, and ask them to give support to NKFI so we can keep doing this really important work of educating and supporting and advocating for kidney patients, because somebody's got to do it. You know, as a kidney transplant recipient, I am so grateful to be a part of this fight. You know, this journey has brought me this far, and I'm just so happy to be working with NKFI and to be able to participate in the education and advocacy and outreach for kidney patients. So the work we're doing is really important, and extra important now during COVID-19. So I'm hoping that people who are watching will support us so that we can keep on doing this great work. And I'm just so, so grateful to all of you guys for taking time to do this and to share your stories. And Dr. Samra is the best nephrologist in town because she takes care of me. So I might be a little bit partial, but that's my story and I'm sticking to it. So thanks for inviting me on, Wes.
Absolutely. Thank you for jumping on. And I'll kind of piggyback on what Monica is saying before I ask my final question to everyone here. And Monica, you can jump on board for the last question too. I'll keep you on as well. But as Monica mentioned, you know, if this is your first time or if this is your 51st time on one of these calls and supporting us, thank you. Thank you for being here. You know, as we said at the beginning, I think it's important for those of us, even if you're already a supporter of the community and you've already been involved with NKFI previously, just to hear these stories, to give everybody a chance to share their experience, especially if you're not as familiar with, you know, the challenges of kidney patients and caregivers and healthcare professionals who serve our communities, and the unique challenges that they navigate as immunosuppressed individuals, as individuals who are awaiting transplants, as individuals who are on dialysis during this crisis, as individuals who are trying to maintain kidney healthy diets right now. They're thinking about a lot on a day-to-day basis. And in many ways, they're thinking about a lot more things that, you know, a lot of us don't need to on a day-to-day basis. And I think that's why we do what we do at NKFI. You know, we have a registered dietitian on staff who's answering questions right now for folks who are trying to figure out ways to keep kidney healthy diets on pantry staples. And we're also, you know, reaching out to people even now and inviting them to seek out our website, because we're posting updates on how to protect yourself from COVID-19 there. So if you're somebody who's seeking that, whether it's for yourself or for a family member or for a neighbor, nkfi.org has all that info that they can share with you as well. And you know, even our virtual patient programs, Monica mentioned that as well. We've transitioned those. Usually they were in person, but now in light of obviously what's happening, we've transitioned to a virtual format so that patients can still access that information. So we have a program, Living with Kidney Disease and Transplantation. There's also el mismo programa en español, Viviendo con Enfermedad Renal y Trasplante. You can find that on YouTube. That has information on a lot of different topics: how to keep a kidney healthy diet, information about transplantation, about dialysis, about how to exercise at home. And you know, if you're moved by what you've heard today and you want to support us, thank you. And nkfi.org is a great place to do that. If you've already done it, thank you. You're amazing. If you're somebody that's just here to educate yourself so that you can educate other people around you about ways to protect both yourself and other people that you care about, thank you. So many times, I think what everybody in this community is doing, both for themselves and for others, is remarkable. And that's one of the reasons why I'm really excited to be a part of any group: volunteers, kidney patients, doctors, just good neighbors, good citizens, all of that. It's something that makes me feel very lucky to be a part of this organization. So if you're moved to take some action on today on Giving Tuesday, sign up to volunteer in the future. You know, we know that you can't come out now, but we would love to have you in the future. When we get back to the new normal, we're going to be more than happy to see you. And we're going to be really excited that you were moved to serve a community in a direct way, like, you know, Michael and Christine and Dr. Samra are doing. If you're going to donate, great. You can do that online too. And I'm happy that you joined us. But either way, I'm inspired, and as Monica said, I feel really good after chatting with everybody here, because a lot of you guys are stronger than you will ever realize. And whether or not you give yourself credit for it now, I hope you do in the future. But as my final question, I wanted to ask all of you, what's one thing that you want to suggest someone in your community, whether they know you or not, whether it's a complete stranger or a good friend of yours, what's something that you would like them to keep in mind so that they can better protect and better care for someone like you in your community? So Michael, we'll start with you. What's maybe one final takeaway or one tip that you want our viewers to remember today? And Michael, you're on mute. So if you could take yourself off mute.
Sorry about that.
Okay.
I think just being mindful, awareness, paying close attention.
All right, great. I love it. Keep it simple. Christine, how about you?
Just keep it in mind that what you do can make a difference. So if it's staying a distance from somebody, or being aware of having a mask on, or when that time passes that we don't need the masks, and after that, when you're sneezing or when you're coughing, be aware that there's people around you, so cover up, and not everyone's as healthy as the other person. So just being a little conscious of like the people that are around you, and they might be immunocompromised or have other underlying conditions that could make them sick. So just being aware.
All right, thank you, Christine. And Monica, how about you? Let's fit you in.
So I want to talk to kidney patients in general and say, don't worry, protect yourself, be smart, and do all of the things that we have been taught to do to protect ourselves, and particularly post-transplant patients from the beginning. So continue and be diligent in that way. And take a look at Michael, who is one of the most vulnerable. He's just over a year out of transplant, and he survived COVID-19. So remember, although COVID-19 is frightening, but there are a lot of people who are surviving it. So we just have to keep that in mind and keep on living, and we can't live in fear.
Agreed. And I feel like, there's a way forward. And I think the way forward, the most important thing is a positive attitude to begin with. I think believing in that, knowing that there are shining examples of the way forward here in front of us, is the best and the greatest inspiration of all. Dr. Samra, how about you?
I would say focus on what is under your control. So practicing mindfulness, like Michael said, making sure you're incorporating movement, whether that be yoga or going for a walk, using appropriate self-protection measures for yourself and for your neighbors. And at the same time, acknowledging what you're feeling and acknowledging your thoughts.
I think that's important, a good lesson. Just be present. Don't be afraid of those feelings. Acknowledge them, and recognize that it's okay to feel that way too.
Exactly.
All right. Well, I think with that, I just want to thank everybody that's here today. Michael, Dr. Samra, Christine, Monica, thank you all. You're strong, you're inspirational, and you're making me feel pretty good right now. So for that, I'm feeling really, really lucky to be in your presence. Hopefully everyone that's joining us today feels the same. Thank you all for everyone that joined us here for this. If you have friends or family members that you want to share this with, we will share this recording later. So those of you that want to share this, seek it out, and KFI will be able to share it with you. We have other recordings and other information available, like I said, on our website, on our YouTube pages. And then hopefully you will be able to connect with all of these good people that we have here on this call. if they're members of your community, thank them, say hello. You know, even if you got a mask on and you got to stay 6 feet away, 10 feet away, or more, don't be afraid to say hello, to say thank you, and also just, you know, take care of each other by doing the right things now. Well, thank you all. Michael.
Thank you
for having us.
Christine, thank
It
you.
was my pleasure.
Dr. Samra, thank you.
Thank you. It's been an honor. Thank you.
Wesley,
Yes.
just wanted to call your attention to the chat where our CEO, Jackie Bishop, says, thank you to all our panelists and attendees. We value and appreciate you.
So, Jackie,
And there's,
Vanessa,
and there's also a message from Gerardo, our outreach associate who works in the Hispanic community, and he gives his thanks as well for providing your time and experiences. And he hopes to see Michael in the 2020 Health Fair events, but I'm gonna have to break it to him, Michael, that you're leaving us, moving out of town.
you're
So.
breaking our hearts, Michael.
It's better weather.
We can't compete with that.
We can't.
I really still want to be a part of it. So some way I can.
Well, I will definitely keep you connected. Don't
Thank
you worry. Don't you worry. So, and I would just like to say thank you to Jackie for, you know, her leadership and guidance and helping us pivot so quickly and do so much stuff virtually to support our community is also important. And I personally am grateful for that. And to you, Wesley, for this great idea to have this discussion.
So, like I said before, this is something that came together through the work and the commitment of the entire team. So thank you, everybody at NKFI. From Jackie on down, it's been wonderful, and I've been excited to be a part of it. And I hope to stay connected to everybody here. But thank you all for joining us.
Thank you.
Thank you for
Thank
sharing
you.
your stories.
Thank you. Thank you, Michael. Thank you, Christine.
Have a great day, guys. Okay.
Yeah.
Continue to stay
Thanks,
healthy.
Dr.
Thank
Samra.
you, Wesley.
Bye-bye.
Take
Thank
care.
you
See you
all.
later.
Bye.
See you soon, Monica. Bye-bye.
Okay, bye.
Take care.